I'm sure I'm going to get some hate messages after this. Frankly, I don't care because this could save someone's life. I'm a nurse practitioner. I am licensed and certified. I am not on the front lines. I have a friend in New York City who's on the front lines. And for her safety, she cannot come out and say these things. So I am her voice. I'm not going to name names of people or hospitals for the safety of those involved. But this is her account, okay? I am her voice here. I'm going to tell you what she has told me. She wants this to get out. Now, I'm sure this is not the case everywhere. I'm confident. I have friends that are in other places. They're on the front lines. They're in ICU. And it's not like this everywhere. But in New York City right now, in some of the hospitals, this is what is going on. People are sick, but they don't have to stay sick. They are killing them. They are not helping them. She used the word murder, coming from a nurse who went to New York City expecting to help. Patients are left to rot and die. Her words. She has never seen so much neglect. No one cares. They are cold and they don't care anymore. It's the blind leading the blind. Now, a couple of weeks ago, I was on with some nurse friends of mine and we were discussing different medications that could be used to potentially help people. Doctors who were reporting around the country that they were using a combination of medications that were helping people. People were not dying when they were on these medications. They were getting better. Those medications are not being used in hospitals in New York City. What is happening is that they're putting people on nasal cannula. If they require more than 6 liters of nasal cannula, they get intubated, they go on the vent, or they get trached if there's not enough vents. They don't get high flow, no non-rebreather, no non-invasive ventilation, no CPAP, no BiPAP. They're on a closed system, the ventilator, versus a CPAP or a BiPAP for fear that it will spread the virus. Which, by the way, I know a nurse in Florida who was fired for exposing that about CPAP and BiPAP and patients being put on the ventilator, like straight away to the ventilator, to be on a closed system. The patients don't know any better. They don't have family with them. There is no one there with them to advocate for them. So they are scared and they give consent. The ventilators have high PEEP, high pressure, which then causes barotrauma. It causes trauma to the lungs. Dr. Siddell, Cameron Kyle Siddell, a few weeks ago, put out a video. He's in New York City, and he put out a video saying something is not right, like we're not treating this correctly. We're doing something wrong. This doesn't make sense. They pulled his video from YouTube and they took him out of ICU.
This is Dr. Cameron Kyle Seidel, ER and critical care doctor from New York City. 9 days ago, I opened an intensive care unit to care for the sickest COVID-positive patients in this city. In these 9 days, I have seen things I have never seen before. In treating these patients, I have witnessed medical phenomenon that just don't make sense in the context of treating a disease that is supposed to be a viral pneumonia. 9 days ago, I presumed I was opening an intensive care unit to treat patients with a virus causing a pneumonia that was ravaging lungs across the world, starting out as something mild, a cough, a sore throat, and progressively increasing in severity until ultimately ending in something called acute respiratory distress syndrome, or ARDS. This is the paradigm that every hospital in the country is working under. This is the disease, ARDS, that every hospital is preparing to treat. And this is the disease, ARDS, for which in the next 2 to 6 weeks, 100,000 Americans might be put on a ventilator. And yet, everything I've seen in the last 9 days, all the things that just don't make sense, the patients I'm seeing in front of me, the lungs I'm trying to improve, have led me to believe that COVID-19 is not this disease, and that we are operating under a medical paradigm that is untrue. In short, I believe we are treating the wrong disease, and I fear that this misguided treatment will lead to a tremendous amount of harm to a great number of people in a very short time. As New York City appears to be about 10 days ahead of the country, I feel compelled to get this information out. COVID-19 lung disease, as far as I can see, is not a pneumonia and should not be treated as one. Rather, it appears as some kind of viral-induced disease, most resembling high-altitude sickness. It is as if tens of thousands of my fellow New Yorkers are on a plane at 30,000 feet and the cabin pressure is slowly being let out. These patients are slowly being starved of oxygen. I have seen patients dependent on oxygen take off their oxygen and quickly progress through a state of anxiety and emotional distress and eventually get blue in the face. And while they look like patients absolutely on the brink of death, they do not look like patients dying of pneumonia. I have never been a mountain climber, and I do not know the conditions at base camp below the highest peaks in the world, but I suspect that the patients I'm seeing in front of me look most like as if a person was dropped off on the top of Mount Everest without time to acclimate. So I urge you, for those of us, if you are out there, for those who work bedside, I urge you to speak up. We can change this. I thank you all for listening. Please spread the message and stay safe.
In light of this important message of this doctor, who I want to add has nothing to gain at all by giving you this, unlike the plethora of people on the news like Bill Gates who have a lot to gain by you taking his advice, this man has nothing to gain and everything to lose. But I'd like to make a few comments, and please take my comments with a grain of salt. Don't believe anything I say, do your own research. But I'd like to point out here that in my video on 60 gigahertz FIVEG, I roughly explained how the uptake of oxygen to hemoglobin can be potentially interfered with electromagnetically. Since releasing that video, I have had further confirmation by a molecular scientist specializing in oxygen. I'll show that later. But I showed how it's well known that 60 gigahertz FIVEG is absorbed by oxygen. I showed you footage of how the heads of telecom admit under oath there have been no industry-sponsored safety testing of these frequencies that they are saying they will release in an expedited manner. No safety testing on humans, no safety testing on the environment. In the video, I also begged that we need further testing to be done before we continue to unleash these frequencies on the world. That video was subsequently removed by YouTube. Now this doctor admits this, whatever this is that he's seeing coming into his ICU is unlike anything he has ever seen before. He says he has witnessed medical phenomena that don't make sense in the context of treating a disease that's supposed to be a viral pneumonia. The thing that they're telling you all over the media that this is without a doubt. He describes that the paradigm that they are told that they would be treating is ARDS, acute respiratory distress syndrome. And quote, yet everything I've seen in the last 9 days, all of the things that just don't make sense, the patients I'm seeing in front of me, the lungs I'm trying to improve have led me to believe that this COVID-19 is not this disease. He's saying it's not behaving as a viral pneumonia. He says, and that we are operating under a medical paradigm that is untrue. And he adds that he fears that this misguided treatment will lead to a tremendous amount of harm to a great number of people in a very short period of time. Are you listening? He's calling this oxygen failure. And he's admitting that whatever this is can be exacerbated by the use of ventilators itself. You heard him say it, not me, that as far as he can see it, it is not acting as a pneumonia and it should not be treated as one. Again, a head doctor in ICU in New York City is saying this, not me. I have no medical advice on this topic. I'm simply asking, can we confirm if 60 gigahertz frequency has actually been unleashed in New York City?